Hey guys, what's going on? This is Dr. Chris Ellis, your West Tennessee chiropractor here at Chiro Plus in Jackson, Tennessee. And today I wanted to do a video over our manual spinal decompression table. We've been getting a lot of emails and calls and Facebook messages inquiring about what exactly it is, what can it help, and so let's just, I decided to make a video about it. So, first and foremost, this table and this whole technique was created by Dr. Gregory Johnson out of Houston, Texas, and he's a wonderful chiropractor. I went down there back in May, spent some time with him in his office, and it was a very just wonderful experience. He sees patients from all over the world with spinal issues and things that other doctors and other therapists have not been able to help. Even people who've been facing surgery or had surgery and it didn't help, still, these people are seeking out him and this technique specifically because it has that much of an impact. So, Dr. Gregory Johnson is the founder and creator of this technique, and he's actually starting research. He's a big research guy. Can't say enough good things about Dr. Johnson. So, but anyway, so this table specifically is going to be great for people who suffer from chronic neck, mid-back, and low back pain. Of course, if you have sciatica or radiculopathy, pain going down your arms, numbness, tingling, peripheral neuropathy in your feet, in your hands or fingers, this table is going to be wonderful for that as well. What we're doing here is we are manually decompressing the spine. So imagine gravity is constantly always pushing us down, okay? No matter what you're doing in your daily activities, your gravity is always pushing us down. So we're always being compressed. Now factor in poor posture, factor in micro traumas from work, or macro traumas from sporting events or work or other things of that nature. However old you are, say you're 59 years old, you've had 59 years of trauma to your spine. And again, 59 years of gravity that is just compressing. And so what happens is, over time, we start getting degradation, degeneration of the annulus fibrosis and the nucleus pulposus in the disc. And so we start getting disc bulges, we start getting disc herniations. These things are very common as we age. They're not always pain generators. However, pair that with, if a disc starts to degenerate, now the spinal joints take on more pressure. And so a good analogy is, if your front two tires on your car are not rotated and balanced evenly, well, now one side is taking on more stress as compared to the other. That's exactly what happens with our facet joints, or the joints in the back of our spine. We start getting facet hypertrophy, where the joint actually grows more bone, and that's simply because it's under more stress. Bone reacts to stress, so it will grow more bone in response to increased stress. And so we start getting facet joint hypertrophy. This leads to IVF stenosis, or intervertebral foramen stenosis. The little hole where the nerve comes out starts getting smaller. And so that can lead to sciatica type pain, radiculopathy type pain going down the leg, going down the arm, wrapping around to the front, all kinds of things, headaches, TMJ pain, just a whole list of things. So this table is wonderful because it allows us to manually decompress the spine from your sacrum, or from your occiput all the way down to your sacrum, which is your tailbone. So in one fluid motion, we're getting all 24 freely movable joints of the spine to move. It's a big adjustment. I'm not gonna lie to you. The first one and the second one are kind of bigger experiences, but we've never been decompressed. So if you've never truly been decompressed, and you can get on a traction table or a decompression table, one of those motorized tables that pull you slowly, and those will do great. But if you're truly looking for decompression, this is the best thing you can do. So there are really contraindications, about 5 or 6 of them, to where we just would not absolutely do this on you. If you have a personal history of a heart attack, a personal history of stroke, a personal history of atherosclerosis, if you have a Arnold-Chiari malformation, which is where the cerebellum starts to kind of herniate down into the spinal canal, we would not do this technique. If you have an active fracture in the spine, if you have an active infection, or if you have active metastasis or cancer, those are going to be the big ones that we will not do this technique on you. And that's simply because we want to keep you healthy, we want to keep you safe, and that is our number one goal as providers for people with pain. So again, this table and this technique is revolutionary in my opinion. Not only does it help with the pain, but it creates a neuroplastic change. And we'll get into that on another video, but we're just kind of tipping the iceberg here on this video. It's more of an introductory video to what the manual spinal decompression table can do. So if you're interested in learning more about it, feel free to reach out. You can call the office 731-736-4200. Our website, chiroplusjackson.com, is loaded with information about this and everything else that we do. Also, check out Dr. Gregory Johnson on YouTube. He's got over 1,000 videos, and again, he's the creator of this, and he does such a great job of explaining what's happening and what we're doing when we do this decompression technique. But I've treated people already who, they've had multiple epidural steroid shots. They've been told that they have to have surgery, or maybe they've been told that they're not candidates for surgery, and so they're taking steroid shots. They're taking medications that the research shows really doesn't do much when it comes to neuromusculoskeletal pain and chronic pain. And so they come here and we do this, and they have a tremendous reduction in their pain level, and their quality of life greatly improves. So again, if you want to come and get a free consultation, perfectly fine. We can talk about it. I love talking about this stuff, and just in general how chiropractic can help with so many things. But call us at our office, reach out to us online. You can schedule online on our website, Facebook message, however you want to do it. But feel free to reach out. We love to help people, and that's what we're here for. So thank you.